name is Nathan Fernandez, and this is the benchmark final practical. This is for kinesiology lab, Wednesday section at 3:15. So, going over a basic overview, we're going to first start with our motion analysis. So we'll have our mock client perform said movements, their daily functional tasks, and we'll get into that in a second. Next, we go into the knowledge of motion, which is basically me, the kinesiologist, demonstrating my knowledge of what proper execution, form, technique, what it looks like for our mock client when they are performing their motion. Next, it'll go into a performance evaluation. So rather than me demonstrating my ability to say what they should be doing, it's really me looking at what exactly they are doing and identify any impairments that are visible, compensations, anything along those lines, which then leads directly into the diagnosis of impairments, where me, the kinesiologist, will diagnose said impairments, and then we'll be able to have an intervention created for them based upon what impairments, what dysfunctions are seen and are present in their motion analysis. All right, so to start, it'll be our sit to stand exercise as our first movement for our motion analysis. What we're looking for here is kinetic chain alignment, neutral spine, any potential compensations during a motion analysis. That's really what the goal is, and it's helpful to get multiple views. So first, starting with an anterior view. Next, the lateral view. Excellent. So that was our sit to stand exercise. Now we will move on to putting on shoes. That'll be our next movement for our motion analysis. And very similar to the first one, we're looking for kinetic chain alignment. This one, we're kind of looking at like a forward lean, because that's a very common trait when putting on shoes, as well as any potential compensations again. Excellent. Well, those conclude our motion analysis. Next, we move on to the knowledge of the motion. So, starting with proper posture. And this is for our sit-to-stand exercise to start. Proper posture. At the start of the sit-to-stand motion, the individual should maintain a neutral spine, upright trunk posture, avoiding excessive thoracic kyphosis and lumbar flexion. The pelvis is positioned evenly on the surface, and the head is aligned over the shoulders without anterior translation. This upright alignment sets the foundation for an efficient movement pattern. Next, we'll go into the alignment of the kinetic chain for our sit-to-stand exercise, and throughout the movement, the kinetic chain remains well aligned. They should remain well aligned, and the feet are positioned hip width apart, with toes pointing forward and knees track in line with the second toe, and the hips rise symmetrically. The shoulders should remain level, and the trunk should avoid excessive forward lean or rotation, ensuring that forces are transferred efficiently from the lower to the upper segments during the ascent. Next, going over the efficient arthrokinematics, joint motion occurs smoothly and efficiently. They should, as the hips, the knees, and the ankles as they flex and extend throughout the erect position. The femoral head glides posteriorly within the acetabulum during the hip flexion and is returned to a centered position during extension. Similarly, the tibia will glide anteriorly on the femur with knee extension. There should be no visible joint restrictions, abrupt stops, or compensatory joint shifts, indicating well-coordinated arthrokinematics. Next, proper force-couple relationships. Muscle groups around each joint should engage in a coordinated, synergistic way. The gluteus maximus, quadriceps, and hamstrings should be contributing to hip and knee extension, while the core muscles stabilize the spine and the pelvis, or keeping that neutral spine and that well-symmetrical trunk. The plantar flexors assist with final propulsion through the ankles, and each muscle group should balance its counterpart to maintain joint stability and produce smooth, powerful movement. Next, moving on to the fine and gross motor control. The transition from sitting to standing is executed with fluid coordination and control. Large muscle groups should generate the primary force, while the smaller stabilizers fine-tune the movement. And the motion appears deliberate and stable with no tremors, no missteps, or reliance on momentum. Postural adjustments are subtle, indicating good neuromuscular control and balance throughout the motion. So that was for our sit-to-stand exercise. Next, for putting on shoes, we're going to go over each of them again, starting again with proper posture. During the task, putting on shoes, individuals should be in a stable seated or standing position with a neutral spine and level pelvis. The head should remain aligned over the shoulder, and the trunk should demonstrate appropriate flexion or rotation without excessive spinal rounding like lordosis, kyphosis, or lateral deviation as well. Postural control is maintained throughout the motion to support balance and efficient movement as well. Next, the alignment of the kinetic chain. The body should maintain functional alignment as the task progresses, In the seated posture, the hips, knees, and ankles should remain in an organized sagittal line with the foot supported as it's brought forward toward the opposite hand. In standing, or when using one leg to cross over, the alignment of trunk and lower extremities adjusts dynamically, requiring symmetrical weight shift and controlled single leg stance to maintain equilibrium. Moving on to the efficient arthrokinematics of putting on the shoe. Joint articulations should function smoothly and within normal ranges during the reaching, the bending, and pulling motions required to put on the shoe. The hip should flex and externally rotate with appropriate posterior glide, and the knee flexes while maintaining joint congruency. The ankle dorsiflexes to allow the foot to slip into the shoe. And if reaching with the hands, the shoulder and scapulothoracic movement patterns should support a forward reach without excessive compensation or restriction, requiring good arthrokinematics of the scapulothoracic joint as well as the glenohumeral joint. And together, they need to work well for the arthrokinematics. Next, moving on to proper force-couple relationships. Synergistic muscles actions are evident as the body coordinates movement between opposing muscle groups. Core and hip stabilizers should activate to maintain pelvic and lumbar control, while the hip flexors, hamstrings, and the abdominals will assist in lifting and positioning the leg. In the upper extremities, scapular stabilizers and rotator cuff muscles will coordinate with the deltoids and elbow flexors to guide the hand to the foot smoothly and with control. Next, and lastly, the fine and gross motor control of putting on a shoe. The action of putting on the shoe is going to involve both large and fine-tuned motor movements. The individual will demonstrate control in shifting body weight, bending or lifting of the leg, and manipulating the shoe with the hands. Grip and finger dexterity are used to hold the shoe and adjust laces or straps, as well as oftentimes shoes will have little spots on them where you do grab to help put shoes on. Right? And the trunk should remain stable and the limbs should be coordinated to ensure balance and safety throughout the task. Now, moving on to the performance evaluation, starting with our sit-to-stand. The client did exhibit some identifiable impairments in their movement patterns throughout the motion analysis. The initial concentric motion upward from the seated position towards a stand had evidence of slight knee valgus. This could be due to restricted or obstructed arthrokinematics at the tibiofemoral joint, where the knee extension occurs from a flex starting point for that seated position. The most likely cause of the slight knee valgus is the synergistic dominance of the quadriceps group to go from that seated to the standing position, as the quadriceps dominance in the motion has biomechanical force vectors working on the tibiofemoral joint, which could cause that slight knee valgus. Because the gluteus maximus is generally going to be the prime mover for a sit-to-stand motion, but as we saw with our client, the quadriceps dominance was evident. So, like I was saying though, with the biomechanical force vectors that the quadriceps dominance is causing on the tibiofemoral joint, it causes that slight knee valgus because it's pulling without enough stabilizing force from the acetabular-femoral abductors like the gluteus maximus and medius and tensor fasciae lata as well, the TFL. Excessive lumbar flexion could be explained by putting the body into a position where the quadriceps can take over as the prime mover for the exercise instead of the gluteus maximus, which normally would act as the prime mover. The new posture of the body puts different biomechanical kinetic forces on the body with the aid of gravity, which cause the quadriceps to take over. Next, putting on the shoe, some identifiable impairments in their movement patterns were seen throughout the motion analysis as well. Limited acetabular-femoral and tibiofemoral flexion occurs throughout the motion, which is causing that excessive lumbar flexion, allowing the distal segments of the upper extremities, the hands, to reach the same distal segments of the lower extremity, the feet, so that the shoes can get on. And this could be due to dominance in neuromuscular facilitation of the movement, where the individual is just practicing these movements patterns out of habit, because your body is not designed efficiently to put shoes on with excessive lumbar flexion and hinging at the hip with poor control of our spine and our posterior chain. So that is likely where these could be coming from, the weakness of the lower extremities causing that excessive lumbar flexion to get the hands to reach the shoes, or to reach your feet to then put on the shoes. Next, we have our intervention slide. So starting with the sit-to-stand, we have a single leg squat as well as skater hops for our exercise. Now, the reason I chose these ones is because the single leg squat, it'll help as an intervention to mitigate current impairments and correct the movement patterns. Because the single leg squat, it's a great exercise to enhance balance and coordination for neuromuscular facilitation, as well as provide a great way for strength training of the lower extremities, so similar movements can be done more efficiently. Doing 3 sets, 10 to 15 reps with moderate intensity, where the focus is a slow and controlled eccentric motion, That will help stimulate hypertrophy for strength gain, as well as enhance balance and coordination unilaterally. The unilateral work will help to correct any impairments that remain one-sided throughout the movement pattern. It'll help neuromuscular facilitation in the future when you come back together and use both feet to perform a squat motion. I guess squatting down to the seated position, but then going to the standing position as well. Skater hops, that exercise will help stimulate the same benefits as the single leg squat. However, the frequency and the addition of the ground reaction forces and more lateral movement, it'll stimulate more strength and coordination of the lower muscles, and it'll challenge them to actually work efficiently from a biomechanical standpoint. It'll condition the body to do movements like these. Conditioning the body, to do these movements, it will lead to the sit-to-stand exercise seem easier on the body, and it'll lead to a more efficient movement pattern, reducing strain on the body via impairments. And so putting on a shoe, the glute bridge exercise is a great way to stimulate strength gain of the posterior chain. The client exhibited limited posterior chain use and strength, so an exercise that is solely utilizing the posterior chain for execution of the movement, it's a great way to stimulate the neuromuscular facilitation occurring for more efficient movement patterns. Another benefit of this exercise is the focus it has on utilizing the posterior chain solely for kinetic chain alignment, which the client did exhibit some difficulty with alignment during their motion analysis. This exercise done in sets of 3 with 10 to 15 reps of moderate intensity should stimulate more efficient movement patterns, reducing the risk of injury and strain on muscles, tendons, and ligaments. Next, Romanian deadlifts. It's a great exercise focusing on hinge and pull motions, which are fundamental aspects of functional movements like putting on a shoe. My client did exhibit some difficulty with the hinge motion, as you saw with the excessive lumbar flexion and limited posterior chain use, and that led to the impairments from a biomechanical standpoint. This exercise done in 3 sets of just 8 to 10 reps of moderate intensity, that will stimulate hypertrophy and neuromuscular facilitation of the gluteus muscles and hamstrings group, limiting low back use for the hinge motion involved with putting on shoes. Proper form is essential, though, for biomechanical and functional anatomy correction. Last, we have a video demonstration of myself performing first the single leg squat for the sit-to-stand exercise, and then next the Romanian deadlift for putting on a shoe. Starting with the single leg squat, starting with the Romanian deadlift, what we're looking for is controlled motions, 2 seconds down, 2 seconds up, first the anterior view, and then a lateral view. We're looking for our feet to remain stable on the ground, not looking for excessive pronation or supination for balancing. And then we're also going to be looking at, for the single leg squat, very similar to the RDL, kinetic chain alignment, making sure that knee is in line with the foot in the hip. And now the lateral view, we're looking for not excessive forward lean or sideways lateral leans, of the trunk via the lumbar spine. So what we want to see our client do is perform these motions as well with the proper form, keeping that neutral spine, keeping the feet, the knees, and the hips aligned, hip width apart with our feet on the floor, which will keep it aligned. These motions, they're a little tough to grasp maybe at first, but my client that I had, active individual, just has some biomechanical inefficient aspects. These interventions will suit him well. However, for more general public, it would be better to maybe choose less intense exercises, as these ones can be a little more difficult for an individual who might not be conditioned for movements like this. And that concludes the final practical